Have you ever found yourself thinking about a movie long after the credits rolled? Maybe even learning something unexpected?
It happens all the time, doesn't it?
Yeah, learning doesn't always happen in a classroom or, from a textbook. Sometimes the most powerful lessons come from, well, the silver screen.
Exactly.
And today, we're taking a deep dive into exactly that idea. How analyzing movies can actually be a really powerful and effective method for active learning, especially in complex fields like, say, health management.
Right. And we're not just speculating here. We're actually breaking down a fascinating study from 2023. It's from the International Journal of Management Education by Yesildag and Bostan.
Okay.
And they rigorously explored this very idea. So our mission today is really to pull out the key insights. How does watching and discussing films actually deepen understanding and make learning stick? And crucially, what conditions make it work best?
Okay, let's unpack this then. Before we get right into the study, maybe we should clarify what we mean by active learning.
Good idea.
It's basically a methodology where you, the student, you're doing more than just listening, right? You're actively thinking, reading, writing, discussing, analyzing.
Getting involved.
Exactly. It's a big shift from that old school, teacher-centered, lecture style, what they call didactic methods.
Yeah, the sit and get model.
Right. And there's solid evidence against it, too. A big meta-analysis back in 2014 found those traditional lectures actually increased the risk of student failure, like 1.5 times higher risk.
No. That's significant.
It really is. It makes a strong case for getting students actively engaged.
And that's where films come in so perfectly. Academics, especially in management and social sciences, they've appreciated visuals like movies for a while now. They see the high potential for success there.
So it's not a brand new idea then?
Oh, no. People like Shampoo were talking about this way back in 1999. He pointed out that students get real cognitive and emotional benefits when they analyze movie scenes using the theories they've learned.
Makes sense. You see the theory in action.
Exactly. And it's often more economical, more time efficient than, say, organizing a real-world field trip, which isn't always practical.
Good point, especially now.
Right. And others, like Desai and his team in 2018, they back this up. They suggested it's great for both cognitive, like thinking-based learning, and experiential learning, feeling it almost. And it's really good value, especially for places maybe without tons of resources.
So it's kind of like a low-cost, high-impact simulation. Is that fair?
That's a great way to put it. And there are even more advantages people like Burke and Smith highlighted back in 2009.
Oh, yeah. Like what?
Well, movies are just fantastic at grabbing and holding your attention with it. They spark imagination. They really foster critical thinking, push you towards new perspectives. They definitely increase understanding, seem to improve memory, and they offer the space for, freedom of expression. Plus, let's be honest,
They make learning fun.
they make learning fun.
Yeah.
And crucially, especially for fields like health management, you get this invaluable insight into how theories actually play out in real organizations. It's not just abstract anymore.
You're seeing it. Okay, so that's the background. With that foundation, the big question becomes, can movies really unlock that deeper learning in something as complex as health management?
And that is precisely what Yesildag and Bostan wanted to find out in their 2023 study. They set out to rigorously test if learning is genuinely possible through movie analysis, and importantly, what level of engagement makes the biggest difference.
A very precise goal. So how do they actually set up the experiment to test those different levels of engagement?
Okay, so they got senior undergraduate students. These were students in the health management department at Karadeniz Technical University in Turkey.
Right.
20 students volunteered in total.
Yeah.
And they were carefully split into 4 groups, making sure the groups had, similar academic qualifications, just to keep it fair.
Okay, 4 groups. And what did they do?
Over 1 month, these students watched 4 different films, all chosen because they had lots of elements related to both health and management concepts.
Makes sense. Which movies did they pick? I'm curious now.
Yeah, it was a really interesting selection. First, they used Patch Adams, the 1999 film.
Oh, yeah, Robin Williams.
That's the one. Great for exploring things like communication skills, doctor-patient relationships, collaboration, bureaucracy in healthcare, all that stuff.
Okay, what else?
Then they used The Intern, the 2015 one with Robert De Niro and Anne Hathaway.
Right, about the older intern at the startup.
Exactly. So that film helped them look at things like organizational culture, intergenerational conflict, maybe workaholism, modern marketing, different leadership styles. Lots in there.
They're a different vibe from Patch Adams.
Totally. Then for a more urgent, crisis-focused perspective, they use Contagion, the 2011 thriller.
Ah, that one feels very relevant now.
Extremely.
Yeah.
It highlighted things like epidemic fighting protocols, the roles managers play in a crisis, ethical issues, healthcare worker rights, the socioeconomic impact, too.
Wow, heavy stuff. And the fourth film,
The last one was John Q. from 2002, Denzel Washington.
right, about the father taking the hospital hostage.
Yeah, that one really brought up issues around health insurance, patient rights, safety culture, organ transplant ethics, um, catastrophic health costs, even comparing health systems. So a really rich mix overall.
That's a fantastic selection. Really covers a lot of ground. Okay, so tell us about these four groups. How do they interact with these films differently?
Right, so the four groups. Group one was the control group, 7 students. They didn't watch the movies, didn't do any analysis, just the baseline.
Okay.
Group two, only 3 students in this one. Sometimes things like student absences affect group sizes. In real studies, they only watch the movies. No discussion afterwards.
Just watch. Got it.
Then group 3, 5 students. They watch the movies, and then they discuss them within their own small group.
Yeah.
The lecturer was present, but basically just as a passive listener. No guidance.
Okay, pure discussion only.
Exactly.
Yeah.
And finally, group 4, also 5 students. They watched the movies, and then they had a discussion, but this time the lecturer actively organized and guided it, pointing things out, steering the conversation towards the key concepts.
Ah, so active facilitation, that seems like a key difference.
It turned out to be, yeah.
So a clear progression, no movies, watching only, peer discussion, guided discussion. How did they measure what everyone learned at the end?
So after the month was up, all students from all 4 groups took the same 30-question exam. It was specifically designed to test the key concepts they should have picked up from the movies.
Makes sense, a standardized test.
Right. And they also wanted the qualitative side, the student experience. So they used a 5-point Likert scale. And, strongly disagreed or strongly agreed to measure how satisfied the students were with the whole movie analysis method.
Okay, the setup sounds really solid. So let's get to the juicy part. What did the data actually show? What were the big surprises in the results?
Well, the results were definitely telling. Looking at the exam scores, there was a statistically significant difference between the average scores of the groups. The p-value was 0.016.
Okay, statistically significant means the differences weren't likely just random chance, right?
Exactly. It strongly suggests the different approaches, the interventions, really did have a measurable effect on learning.
So who did best? Which group came out on top?
The highest performers, and by quite a clear margin, were Group 4. That's the group that watched the movies and had the lecture-guided discussion. Their average score was 71.32.
71. Okay, how did the others compare?
Well, Group 3, the ones who just had the peer group discussion, they scored an average of 55.6. And Group 2, who only watched the films, their average was 44.4.
Wow, okay. So pretty clear climb there. Watching helps a bit, discussing helps more, guided discussion helps the most.
Seems that way. But there's a really interesting wrinkle with the control group, Group 1.
The ones who didn't watch anything, what happened there?
This is where it gets particularly insightful. Initially, Group 1's average score was surprisingly high. It was 64.2.
Higher than the peer discussion group. That doesn't seem right.
Exactly. It seemed counterintuitive. But the researchers looked closer and noticed that 2 students in that control group scored exceptionally high, like between 83 and 90 on the test.
Ah, outliers.
Precisely. The researchers considered these scores more like personal achievements. Maybe those students are just really strong academically anyway, or perhaps studied related material independently. But importantly, those high scores skewed the group average upwards, even though those students hadn't participated in the movie activities.
Okay, so what happened when they accounted for those outliers? To get a more typical picture for the control group.
When they removed those 2 exceptionally high scores to better reflect a baseline learning scenario without those unique individual results, the average score for Group 1 dropped significantly. It went down to 55.32.
Ah, okay. Now that makes more sense compared to the other groups.
Right, and that adjusted analysis really highlighted the main finding. Group 4's scores, the guided discussion group, weren't just mathematically higher. They were statistically significantly higher than all the other groups, including that adjusted control group. The p-value comparing Group 4 to the adjusted Group 1 was 0.020.
So let's boil this down. What's the big takeaway here?
It really seems to point to the incredible power of guided conversation, doesn't it? Having that active guiding lecturer during the discussion dramatically boosted learning compared to just watching, or even discussing without that expert guidance, or, obviously, compared to not engaging with the material that way at all.
Facilitation really matters. It's not just that they discussed, but how they discussed.
Absolutely. It seems to be about making sure the connections are made, the key concepts are hit, maybe misconceptions are addressed. That guidance is key for cementing the knowledge.
And there was another interesting finding, too, wasn't there, about GPA?
Yes. The study also found that the students' overall academic grades, their GPAs, didn't significantly predict how well they did on this specific movie concept exam.
So it wasn't just the good students who benefited most.
Exactly. It suggests this method, particularly with a guided discussion, can be effective across different academic aptitudes. It might level the playing field a bit, or at least engage students in a way that works, regardless of their typical academic performance.
That's a fantastic point for educators thinking about inclusive teaching methods. Okay, so the numbers paint a clear picture. But what about the students themselves? What was their experience like? Did they actually like doing this?
Oh, absolutely. The qualitative feedback was overwhelmingly positive. Students reported really high satisfaction with the whole movie analysis thing. The average score was 4.8 out of 5.
Wow, 4.8 out of 5. That's really high.
It is. And for overall satisfaction, it was a perfect 5.00 average. They specifically said they found the movies interesting, very suitable for the concepts, and that the discussions were really valuable.
Can we hear some of what they actually said? Those direct quotes often tell the story best.
Definitely. Here's one from a student in Group 4, the guided group. I was more interested in examining and learning concepts through watching movies than when they were taught in lectures. That was pretty direct.
Yeah.
They went on. In addition, transferring, interpreting, and discussing what I learned both increased my level of knowledge and contributed to the permanence of the information.
Permanence. That's a key word. Making it stick.
Exactly. Another student said, I think it is a more catchy method than the memorization method. When I combined the events in the movies with the concepts, it settled in my mind better.
Catchy. I like that. It makes learning less of a chore.
For sure. And this one highlights the visual aspect.
Mm-hmm.
I can say that while watching the movie, the character that plays the event is more memorable. Since the image is always more permanent for me, I think learning by watching movies is also permanent.
Visual memory is powerful.
It really is. And then there was this simple, but maybe most telling comment. I learned by having fun while watching the movie.
You can't beat that, can you? Learning while having fun. So beyond just liking it, did they feel they actually gained specific skills or knowledge?
Yes, they did. They mentioned things like expanding their vocabulary and knowledge specifically in health management. They felt they gained experience in understanding organizational culture and structure better. Things like the importance of insurance or patient relationships became much clearer, more real.
Seeing it play out made the concepts less abstract.
Exactly. And one point that really stood out was empathy. Several students noted that watching the movies helped them empathize more with the real situations, shown the struggles patients face, the challenges for healthcare staff.
That's huge, especially for future managers in healthcare. Empathy is critical.
Absolutely. And this actually aligns perfectly with what the researchers themselves observed during the sessions.
Oh, yeah. What did they notice?
They noted that in those Group 4 discussions, the lecturer-led ones, pretty much all the key concepts from the movies were covered thoroughly. And interestingly, even students who are normally shy or quiet seemed to become more willing to jump in, share their thoughts, even defend their views. It created a comfortable yet stimulating environment.
So the guided structure not only helped learning, but also participation and confidence.
It seems so. It really underlines the value of that expert facilitation again.
Okay, so stepping back a bit, this study focused on health management, but what's the bigger picture here? What does this tell us about management education more broadly?
Well, I think it really underscores how important it is to keep trying new approaches, new methodologies. When we're training future managers and leaders, we can't just rely on the old ways. And visuals like movies offer this really unique, cost-effective way to simulate real-life business scenarios. Think about it, especially when traditional things like internships might be difficult to arrange or access, like, during the pandemic we saw that. Movies offer a window into that world.
That's a really practical point. So thinking about you, our listener, how does this apply beyond just health management students?
The principles are definitely broader. Think about how you learn best. Does seeing a concept in action, whether it's a business strategy in The Intern or ethical dilemmas in John Q, does that resonate more with you than just reading about it?
It often does for me, seeing the human element, the context.
Exactly. It could be psychology, history, science. Movies can provide these vivid, dynamic case studies that make things click.
So what are the unique benefits that really stand out from this approach?
I think it's the combination of engagement, memorability, and often that emotional connection. Films grab you. They help you grasp complex ideas. They encourage critical thinking. They build empathy, as we saw, and they bridge that gap between theory and practice.
Right.
It's about making learning feel like an intense live experience almost.
Making the abstract concrete. Now we should probably acknowledge any limitations of the study too, right? For balance.
Of course. As we mentioned, the number of participants, 20 students split into groups, was perfectly fine for these kinds of focused discussions and for showing the method works. But it is a relatively small sample size if you wanted to make very broad generalizations about learning outcomes across huge populations.
So good evidence, but context matters.
Right. But it definitely provides compelling evidence for how effective this method can be, especially, and this seems crucial, with that expert guidance involved.
Okay, so recapping the core insight from this deep dive, actively engaging with films, particularly when you have a guide helping you connect the dots, can be a remarkably effective way to learn complex stuff. It helps your brain and maybe even your understanding of different perspectives, your cultural development.
Absolutely. So the final thought maybe for you, the listener, is this. As you navigate this world just overflowing with information, think about how you could integrate visual stories, films, sure, but maybe documentaries, even just powerful narratives into your own learning. Or if you teach or train others, how could you use them?
What surprising lessons might be hiding in the stories you watch every day?
Exactly. It's worth considering. You might unlock deeper understanding and insights that really last.
A really powerful thought to end on. It definitely challenges us to think differently about where learning can happen. Until next time, keep exploring.